Let's talk about the ABCDEF bundle in the hospital as a nurse, because it's one of those things that really improve your critical thinking. If you're new here, hello, hi, welcome. My name is Judith. I'm an ICU nurse and an F&P student, and I try to give tips and tricks because I feel like I am a little bit of a well-oiled machine at this. In nursing school, one of the first things that we're taught is ABCs, airway, breathing, circulation. When you're a nurse, the ABCDEF bundle is a little bit different, but it really helps not only your communication, but it helps your critical thinking, and it creates a more holistic nursing experience. In the ICU specifically, the A through F bundle is something that we use every single day, whether you know it or not. And if you're trying to get into the ICU, these are one of the things that I think if you bring up in your interviews would be really helpful. For A, we're talking about assessing pain. A lot of the times we're using a numerical rating scale in the ICU, but you can also use something called PCOT. And essentially you will be doing this kind of pain rating at least every 4 hours. Depending on which unit, you might do it more. The one thing to know is if you are giving pain medication, you need to be able to reassess at most an hour later. The B is for breathing. So this is about spontaneous breathing trials. And in the ICU, we really try to get people off of the ventilator because it shows improved quality of life. The C is for choice of analgesia and sedation. Usually you're going to use the RASS scale, but essentially if you're going to provide sedation, you need to also indicate the charting of why you're using it, how much you're using, and whether it's aligned with what the order is. D is for delirium. In the ICU, this is a big deal. We use CAM ICU. We want to make sure we're not causing delirium. It's a real thing. E is for early mobilization. In the ICU, we are turning the patients. Usually, you'll turn them every 2 hours. That's usually protocol. However, some ICUs, if they're very sensitive, you'll do it at least twice a day. And early mobilization, again, improves quality of life. F is usually family involvement and empowerment. As a nurse, you're talking to the family a lot because you're in the room most of the time. The doctor is also going to be talking to the family a lot, and they're the ones that are going to be providing the updates. So working together in the ICU is 100% necessary.